Hi, this is Jovan Serino, and this is my IV piggyback checkoff. So the first thing I'm going to do is I'm going to verify. So I actually have two orders. I have the MAR pulled up, and then I actually have a paper chart. So according to what the orders say, Anna Powolowski is my patient, and she is has an order for cefalozolin 500 milligrams every 12 hours starting now via IV piggyback. So we're going to go ahead, and I've got all my supplies ready, and we're going to go ahead and administer the medication now. Sanitize. Hi, Ms. Powolowski. My name is Jovan. I'm going to be your student nurse today. May I verify your name and date of birth, please? Anna Powolowski, 5557. Okay, and let's check your wristband. Any allergies? Yes, penicillin. And what happens when you have penicillin? You get a rash. Okay, so I'm gonna go ahead and verify that. I have everything here. Okay, great. So I'm here actually to give you some medication. It's an antibiotic for your infection. The name of the medication is called cefalozolin, 500 milligrams. This can cause some diarrhea, nausea, vomiting, and maybe some rash. So just want to give you a heads up on that. Have you ever had this medication before? No? Okay. Well, hopefully this will help with your infection. I'm going to go ahead and I'm going to just take a look at your arm here and make sure that you don't have any evidence of phlebitis or infiltration. So it looks clean. There's no swelling, no redness, and it is not warm, so that's a good sign. All right, so let me just make sure you have everything. Bed is in the lowest position, and it is locked. Call light is here. No clutter on the floor. Okay, so I'll go ahead and get my stuff ready here. And did you have any questions for me about the medication? No? All right, so we're gonna go ahead and take a look at what we have. So we have our medication here, cefalozolin, and I'm gonna take a look. There's no cloudiness, there's no particulates, and the expiration is January 2023. So now that we have this up, we're gonna go ahead and verify this against the MAR that we have, which is Anna Powolowski, cefalozolin, 500 milligrams every 12 hours via IV piggyback, starting now. And we're gonna go ahead and administer this 50 milliliters over an hour. And we have a drip factor of 10, so that gives us 8.3 drops per hour, rounded up to 8 drops, down rather to 8 drops per hour. There's no need to label anything because it looks like the pharmacy has already done the label, so we're good to go there. So we're gonna go ahead and we're gonna perform hand hygiene. And now that we have that done, we can go ahead and open up our bag. Okay, we're gonna pull this out, and we have a little hanger here as well. All right. Okay, so now that we have that, we're going to go ahead and remove part here, making sure not to contaminate anything because this is sterile. Remove the cap. And we're going to go ahead and put that in all the way. Okay, and we're gonna make sure that this is clamped all the way down. Okay, and then we're gonna go ahead and make sure that we have this a third to halfway full. So we got it a little over a third way. Okay, so then we're gonna go ahead and we're gonna prime it, get some done. And let's go ahead and make sure we have the, excuse me, privacy curtain closed. Okay, so I'm going to go ahead and start this very slowly to go ahead and prime it. See the water coming down. I'm going to go ahead and leave the cap on. Okay, and I see it coming down. And we're just gonna get that right to the very end before I stop. I don't know if, can you see that coming all the way? So we're just taking it nice and slow right to the very end. And I'm just gonna leave the cap on so that I make sure I don't waste any of the medication. And it's about to stop right there, right at the end. There we go, perfect. Okay, so I'm gonna go ahead and inspect. And there are no bubbles. Everything is nice and clean. So right before we administer this medication, this is going to be my third and final check to make sure that I'm administering the correct medication to Anna Powolowski, cefalozolin, 500 milligrams IV piggyback every 12 hours starting now. And we're verifying that against the mark. Okay, so now that we got that, we're going to go ahead and we're going to take the top IV bag down. We're gonna put the cefalozolin at the top. And we're gonna lower saline back here. There we go. So now that I have that set up, I'm gonna make sure that this primary one is clamped all the way down. Let me get I'm just gonna sanitize one more time before I do that. Make sure my hands are nice and clean. Okay, then I'm gonna open this, clean the site where I'm gonna be connecting the IV, or the IV piggyback here. So I just wanna make sure that's nice and clean. Now that that's clean, I'm gonna let that dry for a moment. Okay, now as that dries, we're gonna go ahead and remove this. And then we're gonna go ahead and attach it. Okay. All right. So now that this is attached, I'm gonna go ahead and open up this up at the bottom just to make sure that I'm starting this at the right rate. I'm gonna open up the bottom. Let me see, open this up all the way. Second one. Okay, so this is opened up all the way, and now we're gonna regulate it from the bottom here. So we need a total of 8 drops per minute. So we're gonna go ahead and count for 30 seconds and make sure we have at least 4 drops. And that's gonna start 3, 2, 1, now. My 4th, and it's 30 seconds. So just to be on the safe side, we're going to make sure and hold on for another 30 seconds. That's 5, 6, 7, 8, and that is 60 seconds. So we got the 8 drops within 60 seconds that we had there. So that's nice and regulated. And we're gonna go ahead and make sure that that's administering good. So do you feel anything? Are you okay, Ms. Powolowski? So I'm gonna go ahead and just make sure that you're all set here. And just assess your site and make sure you don't have any reaction with infiltration or phlebitis. So while that is happening, I'm gonna go ahead and document the chart that I have administered the medication of cefalozolin via IV piggyback now, 500 milligrams, and that there is no evidence of phlebitis or infiltration. So now that that's been documented, this has been completed, all the medication has gone through. So I'm gonna go ahead and I am gonna stop the top one here. So I'm stopping the secondary route all the way, okay? And I'm gonna get my little clip. And we need to make sure that I did not label the change date on there, if that was gonna stay on there. I made the label here to change. I did not put it on there. So I'm letting you know that I did not add it on there, the change label. But okay, so now we're gonna go ahead and remove it. I've taken the cap off, the red cap that we need. So I'm gonna go ahead and I'm gonna remove this. Now that the medication has been complete, I'll put the red cap on here for this. And I'm gonna go ahead and put the IV back in its rightful spot, up to the way that it was, so it's back in the highest spot. Okay, I will leave the second one on the bottom there just in case. Okay, and now that that's back on, I will go ahead and regulate the primary IV to where it was before. So now that's going to the way that it was before, back, which is now on my pillow, back into the arm. Okay, so now that that's all done, everything is okay. Patient, are you feeling okay? Still no evidence of phlebitis or infiltration. I'm gonna go ahead and put the patient back in her regular position, which I didn't really move her, but are you nice and comfortable? Okay, everything is fine. Lowest position, bed wheels are locked, no clutter. I'm gonna go ahead and perform hand hygiene. All right, I'll be back to check on you soon, Ms. Pawlowski. And now I'm gonna go ahead and document that I have given the patient this antibiotic. I'm gonna document that there was no evidence of infiltration or phlebitis and any other required documentation that the hospital requires. Thank you. I've opened up my privacy curtain.